Last fall semester, that would be of 2012, I did my sabbatical in England. I did it in London, I did it in Kingston, and I did it in Surrey. The purpose of this sabbatical was to compare on a more international level what other countries and how do they address ASD compared to the United States. My first meeting was with Kingston University in Kingston, and I met with the chair of the department, this is special ed, and I met with the faculty. Now, our grad program for the certificate in autism is a 4-course sequence, which again can be completed in 1 year. In Kingston, they go through 3 modules, and everything is based on the modules. It has an audience that possibly needs more content in order to address all the demands and the standards of working with this population. So it takes them 3 years to go through these modules as compared to the 4-course sequence. But our students also, within the master's program, can use the 12 credits in doing their master's work if it's more than just a certificate in autism. Their approaches are similar, their content is similar, but it does take longer. And they do have paraprofessionals within their program, within the modules. So that's on the graduate level. That was one comparison. I then ventured out and I went to Surrey. And it was recommended way before I flew to England that this is the school you want to see. So in Surrey, it's known as the Linden Bridge School. It is superb, absolutely superb. Here in the United States, we can go from preschool to the age of 21. And within the United Kingdom, it's from age 4 to 19. And we had a discussion about that. They're trying within their government, they are trying to go to 25. I don't know, that's quite a stretch, but it is 4 to 19. My visitation there was outstanding. Now you have to realize in the United States, parents are paying for, out of the pocket, a lot of the interventions and the therapies. Maybe not covered by their insurance and so forth. But we're talking about the United Kingdom now, and so that comes under the government. And so I saw so many interventions, hands-on, small group, one-on-one, applied behavioral analysis, on and on and on. So I started with the preschool. And I happened on that day, it was very, very special, that I sat in with a speech-language hearing pathologist. And she was working on communication skills and strategies with the 4- and 5-year-olds. And so it paralleled what we do in the States, exactly what we do in the States. And I observed behaviors that I observed in the United States, okay? Right here with the young children. Wanting to leave, you know, wanting to go home, nonverbal, pointing, using the PEC system, all of that was going on. Then you go to the what would we consider the elementary, probably grades 2 through 6. Wow. They have their content, they have their academic, but they have the pull-out services, some push-in services that we have. Now remember, this is a school only for autism spectrum disorder students. That, I have to make that clear. Totally supported by the United Kingdom. What I was amazed at was that these students are learning French. And I said, how are they doing this? Please show me this. I saw the lesson plans, and I met the teacher. And what they do is they will start with very concrete objects. So this is a desk, this is a pencil in French. When someone comes into the room, you will greet them in French. So it's individual words. The individual words, they're all concrete objects, and they all are visuals. So because they're visual learners. It's almost as if they have a videotape in their head. And if you ask Temple Grandin, she'll tell you, I have a videotape in my head. I'm a truly visual learner. So that's how they start. So this is an apple, and this is a glass of milk, and this is what I want for lunch. And then they build on the individual words, and they create sentences. From sentences, then we have a dialogue. Yes, it takes a while. And I just did very minimal French with them, and they responded, and they made eye contact with me. So now we have 2 languages going on. And I'm thinking, wow, just the English language by itself is challenging. And now we're introducing French because it's international. And remember, they're in Europe, all right. So now we go into the high school. That was amazing. Because in the United States, the situation throughout our nation and throughout the world is, okay, we have them in the schools until 21. And what the parents will say is, after 21, they fall off the cliff. What do we do with them? Can they have a job? Do they live at home? Is it a group home? Do we go to a workshop? What can they do? And so, yes, in the United States, we work very hard in preparing for independent living, for them to be marketable in the workplace, and for society to better understand this population. But I was just taken back. I met them, and they greeted me. We had conversations. I saw their kitchen. I saw their dining room. And every Thursday, I lucked out, I was there on a Thursday, the entire staff and faculty have dinner together, and the high school students prepare the dinner. And you have a menu, and everything is served on a beautiful platter and china. Immaculate kitchen, and all the skills that are involved in making a meal. Think about, you're using math, all right? You're using literacy. Everything's going on there. And they had their aprons on, and they were very proud of their individual jobs. Now, I also lucked out, remember, it's Thursday. So in the afternoon, I'm looking through the window, and I see these little children. And they have these bright yellow vests on, and they're holding hands with their partner. And then I see the teacher and the aides. And I asked, what's going on? Oh, we have a partnership with an elementary school within walking distance. And once a month, on a Thursday, they come. And so it's integration with an elementary school and an ASD school. And what happens is that in the elementary school, they're learning basic skills in math. They're learning a menu. They're learning about nutrition. And so what happens, they come over, and there's a menu, they have their money. And the high school students, there will be one that will be sitting there and saying, okay, here's the menu, now pick what you want. And now they have to figure out the cost, the little second graders, but also the high school have to know that if they gave them a certain amount of change, amount of money, what's the change back? All right, all those skills are being involved. And then the little second graders, they sit down, and they have order strips, and so the high school students go by the order and then give the appropriate students whatever they ordered there, and then there's an exchange, and then they visit the tables. And the socialization is going on, the communication is going on. Outstanding, what can I say? Outstanding. I'd like to see that if high schools here can partner with elementary schools and do the same, because so many skills are covered. I asked one young man, I said, what's your challenge right now? And he said to me, I'm learning how to drive. And I'm thinking, wow, he's on the spectrum and all that's involved in driving. And I said, well, what's the most difficult? And he said to me, we remember it's the United Kingdom. He said, going around those circles over and over and over. I go around those circles. It was such an enlightening day. Similarities, yes, many. Differences is that the government does pay for the services. The parents, and it's in the United States too, parents will move into districts where there are outstanding programs in regard to the special needs population. That's it.